everyone, welcome back to this channel. In today's video, I will discuss some of the MCQs in regards with the NEIGRIHMS exam. Question number 1. Who is known as the father of modern microbiology? Option A, Louis Pasteur. Option B, Robert Koch. Option C, Alexander Fleming. Option D, Joseph Lister. Correct option here is option A, which is Louis Pasteur. He is known as the father of modern microbiology. What about Robert Koch? Robert Koch is known for his discovery about the TB microorganism or tubercle bacillus. And Alexander Fleming, he is known for his discovery of penicillin. And Joseph Lister, he is known for his infection control, or how he use carbolic acid to prevent wound infection before and after surgery. Question number 2. During palpation, local tenderness which is elicited at the Me Burney's point is characteristic features of option A, pancreatitis, option B, peptic ulcer, option C, diverticulitis, option D, appendicitis. Correct option here is option D, which is appendicitis. Pain or local tenderness at the Me Burney's point is characteristic features of appendicitis. And what about pancreatitis? In case of pancreatitis, in severe pancreatitis with hemorrhage, we may find this sign called Gray-Turner sign. It is a discoloration of the flank, or we may find Cullen's sign. It is the discoloration at the peri-umbilical region. What about peptic ulcer? In peptic ulcer, we will find this recurrent abdominal pain, and this abdominal pain usually is in the epigastrium, and it has relationship with food. That means relationship with food. That means in case of gastric ulcer, food worsens the pain, and in case of duodenal ulcer, the pain improves with food. Question number 3. A psychotic reaction in which two closely related persons, usually in the same family, mutually share same delusions are termed as option A, fugue, option B, polyado, option C, JIPMER, option D, barbigeration. Correct option here is option B, which is polyado. Fugue means when a person cannot identify himself or his past. Fugue means loss of awareness of one's identity or past. What about JIPMER? JIPMER is just like the opposite of deja vu. It means when the person cannot recognize or cannot recall the situation or the person which already encountered. Failure to recognize events that have been encountered. And what is the meaning of barbigeration? It is the senseless repetition of some words. Senseless repetition of some word, or keep playing over and over. Play over and over again. Question number 4. Meconium ileus in a newborn baby is an initial manifestation of option A, cystic fibrosis, option B, intussusception, option C, necrotizing enterocolitis, option B, volvulus. Correct option here is option A, which is cystic fibrosis. Question number 5. Pathological repetition by imitation of the speech. Imitation of speech of another person is called option A, echopraxia, option B, echolalia, option C, parallelia. Option D, neologism. Correct option here is option B, which is echolalia. Echolalia is the repetition by imitation of speech of another person. Echopraxia is the pathological repetition by imitation of the behavior of another. Pathological repetition by imitation of the behavior of another is called echopraxia. Parallelia is the repetition sometimes continue, sometimes or continuous repetition of one word. It's called parallelia. Neologism means when a person develop or form a new word or coin new word which only he himself understood, not understood by others. It's called neologism. Question number 6. The process of assigning a specific job to each of the selected candidates is called option A, recruitment, option B, selection, option C, placement, option D, job analysis. Correct option here is option C, which is placement. Placement is the process of assigning a specific job to the already selected candidate. Recruitment is the process of seeking or finding and hiring candidate is called recruitment. Selection is process of choosing the right person or right candidate for a job. Right person or candidate for a job. Whereas job analysis is the process of gathering or analyzing information about human requirement for the company or for the corporation. Question number 7. The deficiency of vitamin B12 can lead to option A, megaloblastic anemia, option B, aplastic anemia, option C, sickle cell anemia, option D, polycythemia vera. Correct option here is option A, which is megaloblastic anemia. Deficiency of vitamin B12 can lead to megaloblastic anemia. Whereas aplastic anemia, it is the disease condition in which the bone marrow does not produce enough of blood cells or decrease in number of blood cells. And sickle cell anemia, it is a recessive autosomal disease. It is due to genes mutation. Polycythemia vera, it is condition in which there is increase in the number of RBC.